Hey Facebook, it's your friendly nosy neighbor, Jessica Cardon with the Murdock Manwaring Company here on this cold and wintry Friday. I'm so excited that we're here, and hey, just thanks for joining us. We're so excited for this 2020 Nosy Neighbors. We have so many businesses that we're excited to highlight. We're trying to do at least 2 or 3 a week. So if you know a business that needs a local business that is looking for a little more exposure and get to be shared on Nosy Neighbors, please private message me. And that way we can get in touch with them and go and visit and ask them lots of questions. Also, if you love local businesses and love following and finding out what's going on here locally with events and businesses and other things, make sure to like and follow our page. That way, you get to keep in the know on all things in Southeast Idaho. And if you're looking to sell or buy in 2020, it's a great time. Give us a call. We'd love to help you. All right, let's get started. So it's a new year. Everyone always is saying, okay, the New Year's I have a New Year's resolution for what? Getting healthier. And so as you think about getting healthier, you're thinking, oh, great, she's going to be at a gym. Oh, no, I'm not at a gym. I think where you should start is, it's backwards. Start with your teeth. So a lot of people don't realize how important the health of your teeth and your mouth is. And so as we were looking at this, we have this great local dentist, Oxford Dental, and they do a great job. And I thought, why don't we go in and talk to them about dental health and finding out what we can do and who they are here locally in Idaho Falls. We are on the corner of Oxford and Cambridge, which I love. I've been to Oxford and Cambridge in England, which was awesome. And this is a little dentist office that's kind of tucked away, and you might not see it. It's kind of off the path, but it's really centrally located. If you turn off of Woodruff when you're going north onto 9th, and you turn west on 9th and come down, you'll hit Oxford, and it's right here. It's a great little dental office with some great people. Let's go in and meet them. There we go. So like I said, Oxford and Cambridge. Cute little dentist office, and I was correct. Oxford Dental. Let's go in and take a look. I'm freezing my tush off. I have my cute outfit, but there's no coat on. Let's see. Oh, I'm going to pull. Oh, here we go. Oxford Dental. There's their phone number, 529-0420. Let's come in and take a look. Well, hello. I'm Jessica with the Nosy Neighbors. Wondering if we could ask you guys some questions about your office.
Of course.
Fantastic.
Dr. Cline.
Dr. Cline. Dun, 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 dun. And the phone rings right at the same time. Look at the cute office.
Hello.
Hello.
How are you?
Dr. Cline. I'm Jessica Cardon with the Nosy Neighbors.
Thanks for coming.
Can we ask you some questions?
Sure thing.
So we're into 2020, right?
Right.
We're talking about health and dental health. So you guys are a great local office here in Idaho Falls. How long have you been here?
So I've been here since June, but the office has been here for over 20 years.
Okay, but you're the dentist, so how did that happen?
Well, so the original office was owned by Dr. Rigby, and then Dr. Pearson was here about 20 years, and Dr. Drew is from Utah. He owned the practice for about 3.5 years, and then I was trying to get back home. I'm from Shelley originally. My parents live in Idaho Falls now, and I was always told home is where your mom is, so I'm home.
I love that. So where did you go to school? So you came back. You're from here. You went. Where did you go to school?
So I did the Idaho Dental Education Program through. Our first year was at ISU in Pocatello, and then the next 3 were at Creighton University in Omaha, Nebraska.
Wow. So lots of people don't realize the dental school at ISU. It's big time.
Yeah. So
like the dental and the hygiene
big.
school, it's a pretty serious place. And you would never know, but it's serious.
There's a lot of dental going on down there. I did after dental school. My dream was to do the residency program down there. It's an extra year after dental school, and so I just wanted to be the best dentist I could for my patients. Yeah. And wanted to have a bigger toolbox to help people out. So did the residency down there, and it was awesome.
So the residency, when I was at ISU, I got my teeth cleaned at the dental school. I think at least 8 times in 2 years, because I had all dental hygiene roommates. So I was getting my teeth cleaned a lot, which I don't know if it's as healthy as it should be, but I had really clean teeth in college. So in that, what is the residency versus the school?
So the residency is, the school is kind of down more in the middle of campus. The residency is right across from Holt Arena. And it's in the basement of there's family medicine up top, and then the residency is down below. And so dental school got me so far. The residency just helped me get some repetitions in on crown and bridge and fillings, just bread and butter dentistry stuff, just everyday things I'm doing, but also learned how to do implants down there, implant placement. Got IV sedation trained down there, so I can do IV sedation. We're not set up in this office with it yet, but probably the next 2 or 3 months we will be. And yeah, third molar extractions, got better at those down there as well. And just an awesome program, a lot of good instructors. And good
very cool.
experience.
So a true local dentist right here. Right. That is exciting. So how long have you been now here in this office?
Since the end of June. I bought it June 26th. I finished the residency June 28th, and then we just started all 4 cylinders in July.
Well, that's awesome. So that's exciting. So in this, when we think about this, what are the people, as we're heading in, we just headed in 2020, what should everyone be thinking about if they're thinking about dental health? What's the stuff maybe we don't know or we don't consider? Because most people just think, I need to get my teeth cleaned.
Yeah.
Every 4 years.
And I think the most, every 4 years, the most bang for your buck is in that tooth cleaning. I think not a lot of people realize that adults over the age of 30, about 50% of American adults of the U.S. population has gum disease. And basically what happens is your tooth is in bone, and gum disease causes the bone loss. It's kind of like a fence post. You start losing bone and the fence posts become wiggly. So it's a quick way to lose all your teeth is just to ignore that and ignore seeing a hygienist. So,
but what if they don't have dental insurance? Is this super expensive to be coming in regularly?
No, it's not. I think a lot of offices offer in-house membership plans, and so you get the benefit of insurance without waiting periods. Or I think if you have insurance through your work, it's a great way to go. I do it that way. But if you're just on the private market looking for dental insurance, I wouldn't. I'd find an office with a membership plan.
So when you talk about that, do you guys offer a membership plan? What is that like?
Yeah, so we do. We're still working out. Like I said, I took over the practice in June, so we're still working out what that's going to look like. But most likely what we're going to have is just like a child option, an adult option, and then a gum disease option. We'll call it a perio option. So, and there'll be different prices on that, but you'll just pay a yearly subscription fee or membership fee, and you'll get perks and bonuses with that, and one of those will be 20% off our fees. So that's about what I write off for insurance plans anyway. So I'm offering an insurance plan without all the rigmarole of an insurance company. So
awesome. So if they want to check into that, do they just call the office and talk to Jessica?
That's right. Yeah,
it's me.
Perfect. So okay, who do you have on your staff? So this is, you got an office. What do you got going on in here?
So I have one heck of a staff.
Oh.
So Jessica up here at the front is amazing. We had a patient tell me that the reason they came to the office wasn't because of me, it's because of Jessica. The way she treated them on the phone and talked to them, and just being easy to work with. So
well, that is awesome. That's a big compliment, Jessica.
Yeah. So I really appreciate it.
So if you don't like Dr. Brent, at least you get Jessica. At least.
Right?
I mean, honestly.
That's right. Let's be real. The team is what makes this place shine. So I'll introduce you to the rest if you
let's go.
want to come back. So
by the way, the office is adorable. Love it. Love the decor.
Yeah, it's not a brand new office, but it's been well updated.
Well, yeah, it looks great.
And I can't take credit for this. This was the dentist before me that moved home to Utah. So
there you go.
Before we meet them, this is our consult room. So we come in here and talk about different treatment and payment plans. If you can't pay for it all up front or something like that, but I like to just go through and show people what's going on in their mouth. So I like to take a lot of pictures so people can see. I don't know how this will show up on your camera.
Yeah, it looks great.
Computer monitor. But just so people can see, if they've got a cavity in their mouth, they can actually see it. So
wow. So these are they see the pictures of their mouths. Wow.
And I don't do this for everyone, but if it's a little more involved case, if it's just one tooth, we'll take a picture of a tooth. But if there's a lot going on, I'll just highlight all the things just so they're educated.
Wow.
So they can take control of their health care. So
That's really cool.
Yeah, that's what we like to do here. We also talked about, cosmetics is something that people like, and we have a great lab that we work with that can give you really nice looking teeth if that's something you're interested in. So
yeah. So as we look at it, we think about that. As me growing up, I always think about big, horrible braces. There seems to be so many different options now on how to get your teeth taken care of. And is it just all price ranges? Are they? I mean, is it past the metal braces with the pink rubber bands?
Yeah, I think there's no replacement for those braces. Mm-hmm. My wife is in braces right now. We do clear aligners here on certain patients, and we could have done that for my wife, but she didn't think she'd be compliant. She thought she'd take them in and out. And not every case is a clear aligner case, but if you've had a relapse, your teeth were straight at one time, but have kind of shifted a little bit and kind of crowding mostly in the lower, in the front, then I think clear aligners is a good option. But I definitely don't do a lot of ortho. We do a little bit, just for those easier cases, or just not as many movements.
Right.
Yeah.
So. Awesome.
Yep.
So do you guys also, as we walk down here, do you guys also do kids? Is it just I know there's. Can you guys do kids as well as adults? Does that matter?
Yeah, we do everyone.
What about dentures?
We do.
There you go.
Yep, we do it all. So, and again, I know my limits, so I did the residency. So dental school brought me here. The residency got me out of my comfort zone up here, and I've settled somewhere in the middle.
Nice.
So we have a lot of great specialists in town that I still refer to, but we can do a lot of it here, which is nice for patients.
Great. Great.
Yep, we'll walk in here. Krista will be our first introduction. Hi, Krista.
Well, hi, Krista.
You didn't know this was going on. So.
Surprise! So, Krista, what do you do for the office?
Well, I'm mostly an assistant.
Mm-hmm. I'm going to try to get a better. There we go. Now we're into the.
Okay, I can change this.
Nope, you're good. So, what does an assistant do when you say that?
We assist the dentist. We just read his mind is what we do. So we try to anticipate what he needs and have it ready for him without him asking.
Perfect. Are you from here, Krista?
I'm not. I've been in Idaho for 5 years. I've moved 40 times, so I don't really have a place that I call home.
Wow.
But, I guess Idaho is home.
Krista's a gypsy. If you didn't know what that means, she's a gypsy.
Yes, but Idaho has become home because I've been here longer. I've been here 5 years, so
love
I've
that.
been here longer than most places, so it's been nice.
Excellent. Well, awesome. So Krista, the assistant, fantastic. I love this room too. I should probably back out this way so you can see how cute this and bright and cheery this. Okay, this is an exam room?
This is a treatment room.
A treatment room. There you go.
So it's kind of nice because you can close the door and have some privacy.
Yeah.
And all of our rooms are private. They all have a door on them.
Excellent.
So yeah, let's see where everyone is.
See what else is hiding around the corner.
I think Kayla's posing there.
Oh, look at this! Someone's getting their teeth cleaned. Who are you guys?
I'm Jenna. I'm the hygienist, and this is Kayla.
I'm Kayla. I started out in this chair, and now I work here.
So they recruited from the chair.
They did.
I love that. So
Yeah.
tell us what you guys do.
So I do the cleanings. So you'll come in every 6 months to see me, and I'll do x-rays and get everything ready for when Dr. Cline comes in.
So as a hygienist, you guys go through a lot of schooling. I only know this because of all my roommates were hygiene students at ISU. So in that, what do you, as a hygienist, what do you do different than the doctor or the dentist does?
So I'm going to actually do the cleanings. So the doctor is going to do like fillings, root canals, where I will talk about education, how you can take care of your mouth, and I'm going to clean your teeth as well.
Excellent. Excellent. And then we've got
Kayla.
And what do you do, Kayla?
I'm also
gonna
a dental assistant.
Oh, excellent.
So I help with the procedures, crowns, root canals, that type of thing. I'm just kind of the one that's just to get in the doctor's head, try to like answer his question before he has to add. I mean, I guess. Yeah.
I'm seeing a pattern of the yes. You guys are there
Is that what
to.
Krista said?
That's right. She's like, we read the dentist's mind. I'm
Yes,
like, there
exactly
you go.
what
I love that. That's always
yeah.
excellent.
Yeah.
Well, that's great. Are you guys here from Idaho Falls?
I'm from Montana.
Oh, what part of Montana?
By Missoula.
Oh, I love Missoula.
Yeah.
Love Missoula, Montana.
And I'm from Soda Springs, just a couple hours southeast of here.
There you go.
So, yep.
Fantastic. What brought you guys to Idaho Falls?
My husband's job.
Same.
There you go.
Yep.
Perfect.
Jenna did her hygiene school at ISU.
Ah, wonderful. ISU's got a great school. How long have you guys been in the biz?
3 years.
1 year.
Excellent.
Yep.
Fantastic. All right. So you guys come in and when they need their teeth cleaned, or I guess either way, they'll see you. They'll see both of them.
Yep.
Again, Jenna's another one. Like I had a call yesterday. It was after everyone had left, but I was still here, and I answered the phone, and they told me. I said, "Well, how'd you find the office?" And they said they knew who Jenna was. They said she was great. So
And there you go.
yeah, I thought they were coming to see me again, but
Man, I'm a little worried also that everyone is really more like you, the girls, and and they're
right.
yeah. I'm sure someone likes you,
That's
Dr.
the
Cline.
biggest
I'm
secret of
sure.
practice, yeah.
Perfect. So we've got now 2 assistants, 1 hygienist.
Yep, and
Excellent.
there's a 3rd assistant. I think I hear her back here.
Assistant. Let's go back this way.
This is our sterilization room and supply room.
Uh-huh.
So, Jess, you'll have to
Oh,
follow me
another
around the corner.
Jessica.
Hey!
I like this office. I feel a pattern of Jessicas and oh no, this is what happens on my thing. Its brains gets confused. Hold on. There we go. I got it. So Jessica, you're back here in the lab. I'm gonna just pull this.
Yeah.
So what do you do back here?
So this is where we sterilize all the instruments. We have our autoclave here. But right now I'm just packaging up some instruments to stick them in the autoclave. This is where we get all of our trays all ready to go. Have all of our supplies in these cupboards and yeah.
So are you from Idaho Falls, Jessica?
No, I'm from Colorado.
Oh, excellent. How long have you been here?
About 5 years. So
Excellent. How long have you been a dental assistant?
about 7 months.
Excellent.
Yeah, it's been pretty
Wonderful.
fun. I like it here.
Her brother-in-law is in dental school at Cardon.
Aha, there we go.
So I heard about Dr. Cline before I even
Oh, yeah.
So you heard about Doc and came for you. Look at that. See, you get a point. There's one.
Finally,
That's
one point.
excellent. Well, wonderful. So great. So when do they see you, Jessica, or are you just in the back?
No, so I'm an assistant as well. So yeah, kind of like what Kayla and Krista were saying, I'm just kind of there to get into the doctor's mind and help him out with whatever he needs, x-rays or procedures and stuff like that. So
Excellent.
it's pretty awesome.
Wonderful. Well, great.
Yeah.
Awesome. So what do we got? I'm going to go this way.
Yeah,
Come this
come
way
on
and do. So we've
Oh, yeah.
seen the exam room. Okay, wait. Now there were two different rooms.
Oh, yeah.
So 2 different things take place.
Right, yeah. 2 of the rooms are hygiene rooms, so for just your cleanings, you'll go see Jenna. And so she hops back and forth between the rooms, and the assistants help her flip those rooms over and get them ready for the next patient. And then my 2 rooms are on the other side. And so when you go to hygiene, I'll come in and do a check, and if you need any fillings or any dental work done.
So if someone is looking to get started, Dr. Cline, and say, I just need my teeth cleaned and I'm looking for a new dentist or I don't have one, I'm new in the area, how much is it going to cost them to come and get their teeth cleaned and get an exam?
Yeah, I think a lot of people are intimidated by the cost of dentistry and also by the just the unknown. It's hard to put yourself out there, especially if you haven't seen a dentist in a while. So I just try to tell people, don't be embarrassed. We see it all. And but the cost for us this year, our promotion, it's going to run the whole year, is a $99 new patient exam for those who don't have insurance. So that includes the x-rays, the exam, the oral cancer screening, and the cleaning.
Wow. It's a great deal. For $99, it's a great deal.
Yeah, it's a good deal.
Now, you said you're getting sedation. When does that apply? When do you need that?
Yeah, so if folks are scared of the dentist, or usually for third molar surgeries or implant placements, I like to do sedation just to help people be more comfortable. It's not putting you to sleep. It's a moderate sedation, which is very safe. And a lot of times it feels like you slept because it has amnesia, just meaning the medicine kind of wipes your memory. So
Wow.
they think they were asleep during the procedure, but I can still talk to them. They're still breathing on their own. You don't have to intubate them or anything, and they come out of it and they don't remember the procedure.
Wow.
Yeah.
So that you guys are going to give that as an option down the road if someone has a lot of anxiety, or
Yeah,
does that work with kids or is it just for adults?
yeah. So my cutoff Rule of thumb is about age 16. Yeah. So
Yeah.
if a kid needs some help getting dental work done, we have some great specialists in the area that can help with that. So sometimes you got to take them to the operating room, and an anesthesiologist will help with that.
Yeah, and if it's too much, yeah. Excellent. Okay, so if they're ready to get started and they know they need to, how do they get a hold of you? How do they make an appointment?
Call the office 208-529-0420 and talk to Jessica, or you can text that number as well.
Oh, excellent. Do they find you on Facebook? Do you guys have a
Find us
Facebook?
on Facebook, yeah. OxfordDentalIdahoFalls.com.
Perfect.
Find us on that website. But yeah, Facebook's probably the easiest. Google, and give the office a call.
But they really should. They should get in here.
I think so. Yeah. We're a smaller office. It's not really fast paced here. I kind of like just having one hygienist. I'm not running around in between rooms, so.
And you know everybody.
I
feel like I know everybody already. That was pretty great. Yeah. So tell us in this, and one thing I do notice, Dr. Cline, is your sparkling white teeth.
Oh my.
What about teeth whitening for those? Is that expensive? Is it something that can happen?
It's not too expensive. Yeah, it's $99 as well. It's really simple. We make impressions or molds of the teeth and make trays for that. And you'll just...
So you do it at home? You don't do it here?
Do it at home. Yep.
Gotcha.
You do it at home and give you about 4 tubes of the whitening material. And you just wear it for 30 minutes at a time.
Oh, excellent. Does it make your teeth super sensitive? I've heard that.
If you wear more than half an hour, yeah.
Those people that take it a little bit too far?
Right, yeah. At least with the stuff we use. There's some solution that's a little less strong, and you can sleep with that in. But yeah, again, I'd say with the sensitivity, you could do every other day if your teeth are feeling too sensitive, or just wear it for less amount of time.
Excellent. So I think that's great. So they can come and they can make an appointment for $99 if they don't have insurance. Come in, get their teeth done, get it started, and if they want to have them whitened and look great, another $99. That's pretty great. Great way to start the year.
Yeah, I think so too.
Well, that's fantastic. Well, thank you for giving us some information. I think this is super important for everybody. Okay, everybody, this is a great time to just get recommitted and say, how long has it really been since you had your teeth cleaned? As adults, sometimes we just let it slide. If there's no pain, sometimes we don't get it done. So give the Oxford Dental a call, Dr. Cline. Just get in here and get your teeth cleaned. Maybe get them whitened. Start out with a great year. This has been Jessica Cardon with the Knowsy Neighbors, keeping you in the know.